right, it's time for a Health Watch this morning, where we discuss all things trending in the health world. This morning, we're joined by Dr. Syed Hussain with Trinity Health of New England over Zoom. Dr. Hussain, good morning. Thanks for being with us.
Morning, Erica. Good to be here.
All right, first off, we're going to talk about the Center of Disease Control and Prevention. They're raising concern over COVID-19 spreading rapidly, and it's also been announced by the World Health Organization that there is a significant spike in deaths and hospitalizations worldwide from respiratory illness. So what are some important things people should know as we inch closer to fall and winter? That's when people typically get sick.
Yeah, absolutely. So as we've discussed in the last few weeks, Erica, it's important that we put things into context. So yes, there has been a spike nationwide in terms of positivity, rising hospitalizations, as well as deaths that follow when we see a bump up in the other two metrics. Now, the wave, this late summer surge we've seen is much less compared to what we've seen in previous waves. But that doesn't mean that folks, don't take this seriously. They should. And especially if you're a higher risk or above the age of 60, then it's really important you have a conversation with your healthcare provider. Make sure you're up to date with your vaccines. And if you live in a county, there are about 7% of counties across the nation now that are in medium or high category in terms of hospitalizations from COVID-19. It's not a bad idea to bring back some of those measures we've used in the past, such as masking, making sure we're testing prior to gatherings, things that we know help and prevent COVID-19 transmission.
All right, Dr. Hussain, I want to talk about NARCAN for a minute now here. Over the last week, it's become readily available at pharmacies, on the store shelves. Of course, the drug is meant to help counter and delay the effects of a drug overdose, but people really need to know some information about this before they plan on purchasing it and using it, right?
Yeah, absolutely. So those individuals that are higher risk or may have been more prone to using some of these recreational drugs. Sometimes drugs may be laced with fentanyl. We've seen that across the nation. We've seen over 100,000 deaths over the last couple of years alone. So this is a huge issue, public health crisis, and this is a very positive step in the right direction. So Walmart, CVS, Walgreens, all of these stores will start keeping NARCAN on the shelves. I'm not 100% sure yet of what the pricing would look like, but this is a nasal spray that can prevent fatal overdose potentially, and it is used extensively currently by emergency personnel, emergency services, and those that fight some of these issues on the street.
A lot of Bruce Springsteen fans disappointed and concerned. He was set to go on tour, but he just announced that he's going to be taking time off because of a string of medical concerns. He's being treated for peptic ulcer disease. I feel like a lot of people don't really know what that's all about. Talk a little bit more about it and what people should know, and how is he likely being treated for this?
Yes, so this is basically open sores or ulcers in the lining of the stomach, or the first portion of the small intestine. And basically what happens is they could have excruciating abdominal pain, nausea, vomiting, bloating. There could be blood in their stool when they have a bowel movement. And there are 4 top causes for peptic ulcer disease in the U.S. So NSAIDs, which are non-steroidal and anti-inflammatory drugs such as naproxen or ibuprofen, common pain medications, are a leading cause. Along with drinking alcohol, smoking, and then the 4th cause is a bacterial infection caused by H. pylori, for which there is a treatment, there is treatment, antibacterials that can be prescribed. But those are the top causes. So if you experience any of these symptoms, then it's important that you seek help through your healthcare provider. All
right, important information. And of course, we wish him a speedy recovery, as always. Dr. Syed Hussain, thanks so much for being with us. We always appreciate it.
Thank you. Thanks so much.
Good.